Thanks for clicking this video. I'm going to take you through an ACL reconstruction that we did recently on a 13-year-old. We used the NanoScope, really taking advantage of the small size and the access that gave us, and utilising the new curved high-flow sheath, which really made life so much easier. So I'm going to flip the camera around and show you the footage from the ACL reconstruction and show you how good the images are from the NanoScope and the ACL reconstruction that we did. So we passed the NanoScope in through a standard portal. This is us looking at the medial joint compartment, establish our medial portal with a knife under direct vision. Using the probe, being able to get right to the posterior horn with the NanoScope. And then we'll have a look at the lateral side, again having an incredible view of the lateral meniscus, being able to establish that it's nice and stable, get right round to the posterior horn of the lateral meniscus and establish that that's all as it should be, which is great. Here we are, lack of ACL, we've already debrided some. You can see the PCL underneath the synovium, the tibial footprint, and looking at the empty lateral wall. Use the shaver just to clear some of the soft tissue so we've got a better view. Here it is with a perfect view. We're putting in the femoral Flipcutter guide. And again, you can see the excellent view that we have. Then from outside, drilling in with the Flipcutter, and you can see it just breaching the cortex there. This is the Flipcutter 3 that we're using. So as you can see just now, we're dialing in the size of the socket that we need. So you only need one, and you can use that for both tunnels at different sizes. So this graft was 7.5 millimeters, and we're augmenting it with Fibertape. So retro drilling, a really great hole. You can see this here. Use the shaver in a minute just to tidy up some of the bone debris that we have. Passing in a fiber stick, and again clearing up some of that debris. You don't want to leave that cancellous bone within the knee. Then use a suture retriever just to grab that fiber stick loop and secure it through the portal, using that later to pass our graft. Here's a tibial jig, just establishing where our tibial footprint would be. You can see this comes in the posterior 1/3 of the guide. Passing in the Flipcutter 3 again, and just advancing it so that you can flip it. Again, using the fantastic adjustable drill tip. You can see that getting larger and smaller. Again, 7.5 in this one, and retro drilling a nice circular tunnel, using the shaver just to remove the debris in the soft tissue, not to impinge on our graft when we have to advance it into the tunnel later. And there we go, there's a tiger stick. You can see that that's striped, so we can identify the difference between that and the fiber stick. And just to make sure we don't get a soft tissue bridge, using the suture retriever, we want to go in and we want to retrieve both of those again through exactly the same portal so that we don't get stuck. And finally, we've advanced our graft in the medial portal, secured it into the femoral socket, and then this is us pulling it into the tibial socket and just watching it tension. You can see the fiber loop sutures in the middle of it. Once we've tensioned the tibial side, we'll just check with our probe. We also tension the Fibertape to take up the slack and secure that with a swivel lock in the tibial cortex. And that concludes our ACL reconstruction.